Osteoporosis is often associated with women, but men can be affected as well. But there are things you can do now to protect your bones in the future. Here's Dr. Morgan Sauer with more.
We're learning more and more that everybody is at risk. Women tend to be at higher risk because osteoporosis kicks in because of menopause and the change in the hormones from menopause. However, we are finding in men that they are developing osteoporosis, especially as we're living longer. And there may be some links to testosterone production, which naturally declines in men as we age.
Are there ways that you can keep osteoporosis from worsening?
Being sure to intake enough calcium and vitamin D together, and also being sure you choose the right type of calcium. You need to speak to your doctor about using calcium that will separate in the stomach on acid-reducing pills and calcium that won't.
You mentioned calcium and vitamin D, so how much do we need?
Different schools have different thoughts on this. You can hear different recommendations. I'm recommending my patients to take between 1,200 and 1,500 milligrams of calcium a day and at least 800 units of vitamin D.
Can medications for other illnesses actually promote bone loss?
Some of them can actually do this directly, others may do it indirectly. If you're on medications for reflux, which is very common in America, it changes the acidity of the stomach, which can decrease the absorption of iron and can also adjust the absorption of calcium. So it is important to choose the right type of products for replacement when you're on different types of medications.
Any other lifestyle changes that you could recommend doing now to maybe prevent osteoporosis in the future?
Exercising now helps maintain bone strength. Additionally, we know that smoking is terrible for the bones, so people need to stop smoking. If women enter into early menopause, they may want to really look more closely at getting treatment earlier.
Doctors recommend screenings every 2 years for women after menopause. But if you're already showing symptoms or are in the high-risk group, you should see your doctor for a screening yearly. For today's St. Vincent Corner Clinic report, I'm Jancy Sheets.